So I want to take you to a policy question. We're seeing across much of the country a fairly precipitous drop in numbers of cases and also hospitalizations. How do you put the pressure on people to keep interested in long COVID?
Well, that's a really good question because, probably for good reasons, we like to say problems are in the rearview mirror. Let's focus on tomorrow's one. Long COVID isn't going away. Francis, I've been saying about COVID that even when all the health officials declare that the public emergency is over, the two pieces that are going to continue are long COVID and the combined mental health impacts of 1 million people dead and people having lost jobs and lost businesses, and obviously the mental health impacts of those who are dealing with long COVID years after they had COVID. So these are the two pieces that are going to stay at it. I will say I feel pretty optimistic about us not losing focus on this because my colleagues and I'm on the Health Committee in the Senate, Health, Education, Labor, Pension. We hear about this from people wherever we go. Maybe particularly since I've chosen to talk a little bit about my own symptoms. Folks come up to me on the road, they tell me about it, but I think my colleagues in the Senate, they're hearing about this from their colleagues at home, from their hospitals and healthcare providers, from employers. What do I need to do to provide an accommodation to let this, really good employee continue with me, even though they're still laboring under long COVID symptoms? I don't think the long COVID community is going to be silent, and they're not going to let us forget them.